Today, we're going to demystify bladder cancer. Let's cut right through the jargon to understand what it is, what to look for, and, most importantly, what really decides how it gets treated. And it all boils down to one kind of surprising factor.
So I really want you to hang on to this question because it's the single most important idea for understanding bladder cancer. See, it's not about how wide a tumor is, it's about how deep it's managed to burrow. This one concept, it changes everything.
All right, so to really get what's going on, we've got to start at the beginning. Let's take a quick look at the anatomy of the bladder itself. Okay, so check out this word, urothelium. The easiest way to think about it, it's like the special waterproof wallpaper that lines the inside of your bladder. And this specific layer of cells, well, that's ground zero for almost all bladder cancers. And wow, this chart really drives that point home. I mean, look at that. A whopping 90 to 95% of cases are what we call transitional cell carcinoma, or TCC for short. And yep, you guessed it, it starts right in that urothelium wallpaper we were just talking about. The other types are way less common.
Okay, so that leads to the next big question, right? What puts someone at a higher risk for this? Turns out the risk factors can actually be pretty different depending on which type of cancer we're talking about.
For TCC, that most common kind, the number one thing on the list is smoking. It is the major factor, no question. After that, you've got things like being exposed to certain industrial chemicals like aniline dyes, and even some specific drugs or radiation treatments can up the risk. But now, let's switch gears. Look at the risks for the much rarer type, SCC. You see the pattern here, right? The big theme is chronic irritation. We're talking about things that just constantly bother the bladder over a long time, like bladder stones or having a catheter in for an extended period. Okay, so we know where it starts, we know some of the risk factors, but what does it actually look like? What are the red flags that would make someone say, I should probably get this checked out? Well, first off, if we look at who tends to get this, it's typically older folks, in their 60s and 70s. And it does show up more often in men than in women.
Right. Age and gender aside, there is one symptom that is the absolute number one sign to watch for.
And that is painless hematuria. Now, that sounds like a complicated medical term, but what it actually means is super important for everyone to know. Basically, it's just this, seeing blood in your urine, but with no pain. None. And here's the really tricky part. It can be intermittent. It might happen, then go away, then come back weeks or even months later. That's why you can never just brush it off. So yeah, that painless blood in the urine is the big one, but other things can pop up too. It's sometimes called vesicle irritability, a fancy term for things like having to pee all the time, feeling a sudden, desperate urge to go, or even having pain when you do.
Right, so someone has these symptoms. They go to the doctor. Now what? How do they actually go from just a suspicion to knowing for sure?
Well, the main way they confirm it is a two-step deal. First up is something called a cystoscopy. A urologist uses a tiny little camera to actually look inside the bladder, and if they see anything that looks a bit off, it's on to step 2, the biopsy. They just take a tiny piece of tissue to get it checked out under a microscope. And, there are other tools in the toolbox. They can look for cancer cells in the urine or run tests for specific tumor markers like NMP22 and BTA, which can add more evidence. Okay, now we're at what I think is the most crucial part of this whole thing, treatment. Because how it's treated all comes back to that one question we started with at the very beginning. This right here, this quote says it all. The single biggest thing that decides what happens next is how deep that tumor has pushed its way into the bladder wall. And this slide just lays it out perfectly. There are two completely different roads to go down here. On one side, you've got superficial tumors. They're just on the surface layers, they haven't gotten to the muscle yet. The treatment for that is pretty local. They remove the tumor and then they might put medicine right inside the bladder to keep it from coming back. But if that tumor gets into the muscle layer, whoa, it is a whole different ballgame. The treatment gets way more intense, way more systemic. Yeah, for those deep, high-grade tumors, the plan is a full-on multi-stage attack. It usually starts with chemo to try and shrink the tumor down, then comes a massive surgery, and then, you guessed it, often more chemo after that, just to be sure.